Hi, I'm Dr. Tracy Marks, a psychiatrist, and I make mental health education videos. Some people will use stress and anxiety interchangeably, but stress and anxiety are not the same. There are some distinct differences between the two. Why does this matter? Well, one reason is because there's an herbal remedy that's gaining a lot of attention that works for stress, but not so much for anxiety. First, let me explain the difference between stress and anxiety from a biological perspective. Stress can cause feelings of angst, usually triggered by a circumstance. The circumstance can be financial pressures, the pandemic, having too many responsibilities, relationship conflicts, etc. These circumstances, called stressors, can trigger you to have an anxiety reaction, such as chest pain, trouble breathing, or worrying. You can be stressed emotionally or physically, and there's a specific biological response to both of these kinds of stress. Having surgery, spraining your ankle, or getting the flu are examples of physical stressors. All of these situations increase cortisol, which is one of the body's stress hormones. Your stress hormones serve the purpose of preparing your body for a fight or flight response. Cortisol is a steroid that increases your blood sugar and suppresses your immune system. It does this by blocking chemicals in the body that create inflammation. And by the way, just as an aside, you may be familiar with hydrocortisone creams. Hydrocortisone is a version of cortisol that you can buy as an over-the-counter medication to treat allergic reactions or inflammatory skin conditions. So cortisol is a chemical that the body needs for certain functions, but having excessive amounts of it and persistent amounts of it cause problems for you. Your cortisol levels fluctuate throughout the day, and you tend to have your highest level first thing in the morning, and then the level falls off as the day progresses, with the lowest levels occurring in the middle of the night. Then it increases again as your body prepares you to wake up. If you are under a lot of stress, you can have higher than normal cortisol levels in the morning, called the cortisol awakening response. If this happens to you, you can wake up with a lot of anxiety symptoms like feeling tense, nauseated, or panicked. Some people can wake up feeling chest pain, and this can feel very jarring because you expect to wake up feeling relaxed and refreshed in the morning, and here you are already in a panic. Then your cortisol levels are supposed to drop during the day, but if it doesn't drop enough, because let's say it started out really high in the morning, or your stress state produces surges of cortisol during the day, the high level in the evening can make it hard for you to fall asleep or even stay asleep. Your morning cortisol levels can vary depending on what's going on in your week. One of the studies that I referenced in the description found that test subjects had higher morning cortisol levels on work days than they did on the weekends when they didn't have to work. So that's stress. It can be mental or physical and result in elevated cortisol levels. Anxiety, on the other hand, is affected by a different part of the brain. Your amygdala, which is located in your temporal lobes, detects threats even before you're consciously aware of them. Your prefrontal cortex is the part of the brain that processes threats and fears. Anxiety is different from stress because it's generally based on fear or worry about a threat. You may say, well, if I feel overloaded with responsibilities, the stress makes me fear that I'm on the verge of failure. Well, yes, stress can trigger anxiety or make pre-existing anxiety worse. But with true anxiety, you don't need a trigger to experience the symptoms, and your fears and worries don't have to be based on real threats. For example, here are some of the fears with common anxiety disorders. With social anxiety, you fear being humiliated or embarrassed, whether that's a real probability or not. You assume whenever you're around others or in a performance situation that humiliation is the inevitable outcome. With panic disorder, you may fear that you're dying or having a heart attack. Even if you've had 50 other panic attacks that were never heart attacks, each attack you have presents a new possibility that this time may be different. With generalized anxiety disorder, you worry about worst-case scenarios for any situation. And with separation anxiety, you fear losing people close to you. So can you see the difference between being consumed with these kinds of fears versus having a negative response to situational stressors? Situational stressors, especially if they're prolonged, can cause you to have persistent anxiety symptoms like the morning panic, sleeping problems, or trouble thinking and processing information. Prolonged stress can also cause physical problems like high blood pressure, insulin resistance, and weight gain. And you can experience all of these stress problems even if you don't already have an anxiety disorder. If you have an anxiety disorder, becoming overwhelmed with stress makes your anxiety more unmanageable. There's lots of things that you can do to reduce your stress, but one intervention that falls under the category of complementary and alternative medicine is the herb ashwagandha. Ashwagandha is an evergreen herb in the nightshade family that grows in India, the Middle East, and Africa. It's been used in Indian medicine for centuries as a medicinal herb that imparts intellectual power, long life, and vigor. More recent research has looked into ashwagandha as an anxiety treatment. So far, the studies have shown that it helps anxiety in people who are under a lot of stress, but it's not as good at relieving anxiety in people with an anxiety disorder. Why? Because the way it works is by reducing cortisol levels, especially morning cortisol levels. Herbs that improve your body's stress response are called adaptogens, and they work by normalizing your body's physiologic responses in times of stress, like in this case, reducing high cortisol levels. So far, I haven't seen consistent recommendations as far as how much to take, but most studies that I've seen use 250 milligrams to 600 milligrams taken in the morning. High doses greater than 1,000 milligrams have been associated with side effects of nausea, vomiting, and diarrhea. And there's also been a few reports of liver injury at the higher doses. So if you're feeling overloaded with stress, ashwagandha may be worth a try, especially if you're having intense morning anxiety or broken sleep. These are signs that you may have persistently elevated cortisol levels as part of your anxiety, and lowering your cortisol may bring you some relief. Of course, things like exercise, breathing, and meditation also help decrease stress related to anxiety. Take a look at this video that I did talking about how exercise affects your brain. Thanks for watching. See you next time.